So much like so sophisticated. Mine look bootleg.
And so you were telling me about how did and you cope with loss.
Well, in all reality, do you really cope with loss? You can't. You can't cope with loss. Um, it's like life. It's just what you experience. It's what you experience. Loss. You experience gain. Um, both of them is not something that you really cope with, but you learn to overcome it. You learn to overcome loss. You learn to overcome gain, because when you gain something, you always want to continue striving. You never put a limit on yourself. You never put a limit on yourself. When they say the sky is the limit, no, it's not. You can go so much further. You can go as far as you allow yourself to go, or as far as you want to go. Don't ever let anyone tell you what you cannot do.
Do you think that through the loss, every time you lost a patient or you transferred patient care, do you think that patient taught you a new way to communicate, or?
I cannot say it got easier.
Yeah.
I cannot say that, because, that I was blessed to say that each patient that was lost, that they went in peace. And the comfort that I did receive is being a child of God. I know that absent in the body is present with the Lord. So that was my comfort in knowing that they no longer had to be in a place they did not want to be.
Right.
And care was not really balanced, because one CNA may take care of a client a whole lot better than another will. Unfortunately, through my experience, which being the best teacher, that you have individuals in any career choice that they're doing it because they want to do it, or they're doing it because of paycheck. There's a difference. There's a difference. The things that my work experience was not something that I did for the pay. This was something that I had an interest in and compassion in, so that I knew that because it was something that I enjoyed doing, that I was going to give it my all. Even if I had good days or bad days, I took both of them in stride, because if it was a bad day, it was an experience. If it was a good day, then it was something that I learned, because each day is different, and you have many tasks and obstacles that varies in your path in the medical field. There's never a dull moment. You never know what to expect. So you always go in prepared. You always go in prepared, and that's your main key to life. Always be prepared. You're gonna have surprises, but then surprise yourself by being prepared, or surprise whatever task you have at hand by being well equipped for what you need to get done that day.
How would you, for someone who is just coming into it, what would be your advice to them?
Make sure this is something that you want to do. Make sure this is something that you want to do, because you have individual lives in your hand. It's not for you. Well, I'm not sure if this is what I want to do or not. Make sure this is what you want to do, because as I stated, you will be caring for people who cannot care for themselves, and some who can, that they want to be able to do for themselves, and if they can, allow that patient to do for themselves as much as they can do.
Right.
And whatever they cannot, explain to them each procedure, each step accordingly before you proceed with it. Well, okay, I'm going to help you dress. Okay, I'm going to help feed you. Try to encourage that resident or that client to do as much for themselves as they can. Don't be pushy about it, of course not, because it's going to irritate them more than and damage progress more than anything. In patience, you have to have a lot of patience. I keep in mind that this could be me one day.
Right.
And I would like to know that I would be very well cared for. Or this could have been my mother, or this could have been my father. I want to know that if I am was ever in a situation that I could not care for my parents, then if I cannot care for them, then I want to do my research and make sure that I know everything and educate myself about this organization or this facility, because these are people that I'm trusting my mother and my father's life, I'm putting their life in their hands. So, it has to be personal, and it has to be what you want to do. You can't second guess about it.
Did you ever have any patients that weren't able to communicate with you, like that were nonverbal?
Absolutely, absolutely. Not often, but I had some who could not hear or speak, but they could read lips and sign language, and I know very little sign language. But as I stated, each day is, you never know whom you may be caring for that day. That you can have assigned a certain hall, and you get used to those residents or those patients on that hall. But then occasionally you have a new patient that come in, whether they cannot hear, or they're not mobile, or they cannot talk. You're taught in the medical field to be able to communicate with any patient. That's your calling. That no matter whom or what their disability may be, that together you can conquer that together. There's a way of communicating with people, and you will study that in sociology. There's called verbal and nonverbal, and there's always a doorway open to communicate. Well, or if it's just eye contact, you're communicating.
I bet your patients felt very loved.
I like to think so. My can't really say it's my downfall or a flaw that I have, but I love to talk, and they miss that. If you have a patient, they're so used to the doctor coming in and out, or their nurse coming in and out, or a family very seldomly visiting. So when they do have that undivided attention, you know what? You just shared Christmas with them, because you gave them the greatest gift of all.
Well, and I would imagine that especially in a living situation where they're living in a facility, I would imagine communication is the biggest thing, because they wouldn't get that, because a lot of people in and out taking blood pressure, like you said. So I would imagine just the communication part of it. It's like, oh, somebody's talking to me.
Exactly. And any time that you're dealing with a patient, you must be in communication with them at all times. Even if, before you even entering the room, you have to knock on the door, so that way they are aware that, okay, well, I have guests. You're in their home. You're in their home. So yes, every and anything that you do, you're communicating verbally, or you making gestures, and some enjoy that attention, and then there are some that they did not get that proper attention, that they were maybe handled, and heaven, forbid to even think that, but they were handled unprofessionally.
Right.
There's no other word that I can describe it to put it nice. No, they experienced an unprofessional experience from their caregiver, and that's not acceptable, but you get past that. Once they get to know you and, you gain their trust, it's the most beautiful thing, and you can never go wrong. The greatest gift you can give anyone without a price tag, that's yourself. And you can never go wrong. You can never go wrong when you give yourself to someone.
Do you think a lot of lack of communication in the field is people forgetting that the patient is a human and that it's not a piece of equipment that we use daily?
And or forgetting why they're there.
Yeah.
Why they chose that career, that field. And how easy or to say, and how soon we forget. This is a career that you've chose, because you had a passion for it. To help build lives and not tear them down. Or to help those who cannot help themselves, because, that could be you or I one day.
Right.
And I would like to think that, that is not something that anyone would have to cross over and forget that they're not human, that, they're just some object, or just some object to study. No, we're talking about human beings that live and breathe, that if you and I bump ourselves, we're going to bruise. If we cut ourselves, we're going to bleed. that there are life and feelings in that being.
Right.
And communication is everything. You know, you can just sit and not say anything, but the communication of just presence, of knowing someone is near, you know.
And then in telling, and they can tell that you care about them, obviously.
Exactly. Yes.
Did you know early in life that this is what you wanted to do, that you wanted to care for people, or was it just as you came through the?
I've known all my life because I have always cared for people, whether friend or foe. You know, no one ever wished anything bad upon anyone. But if you see someone hurt, you just want to render their aid. Or if you see a child cry, you just want to pick them up. This is something that you instill from little. You know, that when you fell and you scraped your knee, how well you felt, how much better you felt when your mom picked you up and she embraced you, or your dad picked you up and he just loved you. You know, you knew that great feeling, how well it felt to be rescued, or, you know, to be loved. So I